You don't want lead in the paint in your house, so you certainly don't want it in your mouth.
But an Ohio woman suffered lead poisoning earlier this year after someone discovered her imported dental work was contaminated. After the story broke, Florida lawmakers stepped up to protect patients. But as News Channel 8's Krista Claus reports, the law is lacking teeth.
Philip, 12, has no idea what's in his dental work.
They just said it's porcelain. But I really don't recall if they said where it was manufactured.
Neither does Owen Hardin.
I never asked, but I have wondered.
But now patients in Florida have the right to know exactly what dentists are putting in their mouths.
It will maybe eliminate some of this offshore materials that's coming over here and restorations.
Bud Spencer makes dental restorations at this Dunedin lab and says the new patient safety law will discourage dentists from buying cheap porcelain from China, porcelain that in some cases has been found to contain lead.
We know that we're getting a quality porcelain from a U.S. manufacturer. You don't know that from what comes from China.
Florida is the first state in the country to keep tabs on dental materials. Faye Lewis traveled from Ohio to lobby lawmakers back in April after discovering the bridge she'd worn for more than a month contained lead.
What it made me feel was first fear, concern, and then anger. And that's why I'm here. I'm angry that somebody can get away with this. Many somebodies, obviously.
But the bill lawmakers passed was considerably watered down, requiring disclosure only when the patient asks for it.
The patient should not have to try and figure out from the dentist, hey, where's this made? They should be presented that up front.
The new law also will create a paper trail for dental materials. Dental technician Buddy Wester says he follows strict regulations when building implants or molding partials, but overseas labs, he says, don't have the same regulations.
If the restoration comes in from overseas and it has some type of hazardous material unbeknownst to the dentist and the patient, and the patient becomes ill in whatever manner, then there's no way to track that restoration.
The new law is designed to give patients more detailed information about what goes into their dental work. But remember, your dentist is only required to provide that information if you ask for it. For 8 on Your Side, I'm Krista Claus.
The new lead law takes effect January 1st.